to help you get healthy.
At first, we constantly see commercials, bombarded with them in fact, and read about the success stories that some have had with what's known as lap band surgery and other weight loss surgeries as well. If it's something that you have or maybe are currently thinking about, good timing for you because we're about to get some expert input.
Dr. Joseph Kuhn, a weight loss surgeon on staff at Baylor University Medical Center, Dallas, is here with information about weight loss procedures. And it's really great to understand the difference, doctor, and what may work best for each individual. Many people are looking at surgeries like gastric band to lose weight. Let's start with that, the band. How does that work and what do you think about it?
Okay. The band works as a restrictive device. So it's like putting a little band around your upper stomach. So when you eat, food gets held up before going through. It's really very critical on a band to eat solid food and not drink with food. The band doesn't really reduce hunger as much as some of the other operations, and so it takes a lot more motivation and willpower to be successful with the band.
So in essence, you're taking what usually might go down a piece of pipe and whittling it all the way down to a straw. Can I think of it in that way?
That's a good way to think of it, and sometimes we say we're kinking a hose, so the food has to go down and it fills up at an earlier level.
So why is this a challenge for some people? Is it something you have to stay committed to? Is it something you have to think about every day? Because I think that's a difficult thing for most people. If I say, okay, I'm going to go have a surgery, I expect you to fix it and I don't have to think about it. But post-surgery, this is something you have to work on a bit, is it not?
Right. With the band, it does require a lot of follow-up, going in to see your doctor. It's a relationship with that doctor and that clinic. It just simply requires eating correctly. Now, some patients we're learning as of last year that will develop heartburn or indigestion, reflux.
Right.
And the current studies as of this past year show that about 30% might end up with a band removal because of that.
So that is new information that you really need to pay attention to when it comes to the band. Compare that then with gastric bypass surgery.
The gastric bypass and the gastric sleeve are the other two operations that we offer patients. And we always think of one operation doesn't fit all patients, so we want to talk to the patient and choose the right procedure for them. For example, if they have severe reflux, heartburn, indigestion, the only operation that works optimally is the gastric bypass.
What's the general threshold for people? You know, where do they have to be in age? Where do they have to be in weight for you to say, good candidate?
The easiest way to think about it is if you're about 80 to 100 pounds overweight, then research suggests that it's very difficult to lose that weight with diet and exercise. The statistics are about 1% are successful. And so typically that's the population. Let's say it's a person who's 5'5", they're supposed to weigh 150 pounds, and if they weigh 230 to 250, especially if they start getting things like diabetes, hypertension, cholesterol, sleep apnea, that's a good population.
That's when you recommend the procedure.
Right.
Who then do you believe is best for the gastric sleeve?
The gastric sleeve is increasing in interest and enthusiasm. It's been around for about 5 years. It too is sort of it's in between the band and the bypass in terms of weight loss. So for a band, we might lose 50% of your excess weight. A bypass, you might lose 80% of excess weight. A sleeve, we expect you to lose about 70% of your excess weight. The only contraindication to a sleeve might be somebody with severe reflux, because that has really been the only downside for a sleeve long term.
Be our patient advocate for a second before we let you go. We're winding down, but be that advocate for me to say, Doug, these are the questions you need to ask when you're shopping for a doctor about this. What as a doctor who does this, would you want patients to ask before choosing who they're going to use?
What I would encourage a family member of mine to ask is, one, the program, do they have dietitians, support, psychological support, and the surgeon? Do they offer all three operations, and do they demonstrate skill and attention? And then lastly, can you establish a relationship with that doctor? Because key success is a relationship with that doctor.
And real quickly, insurance. Does insurance cover all three of these procedures?
Insurance now covers all three, with the exception of Medicare and the sleeve.
All right, lots of questions, lots of great answers though. Thank you so very much, Dr. Joseph Kuhn. We appreciate your insight today.
Thank you very much.
Doctor, thanks for being with us. Well, one way to keep the weight off for sure is to watch what you buy from those vending machines.
As CBS 11's Keith Garvin explains, a new company is giving customers options.